IGEPHA im Gespräch. Der Podcast der Austrian Self Care Association.
Hello and a warm welcome to IGEPHA im Gespräch, the podcast of the Austrian Self Care Association. My name is Christina Nageler. I'm the Managing Director of IGEPHA. In this podcast season, we are taking a world tour to visit self-care organizations in other countries. Some of these countries are true role models in the implementation of self-care into their health services, and we are eager to learn more about this. Today, our journey takes us to Sweden, and I'm very excited to be speaking with Karolina Antonov. Karolina is Head of Strategy at LEAF, the Swedish Association for RX and OTC companies. Welcome, Karolina. Nice to have you here.
Nice to be here, and thank you for inviting me.
Before we dive right into the topic, I would like to briefly introduce you to Karolina. Karolina is responsible for market access and health data, and is also responsible for the OTC committee at LEAF. She started working in the association already in 2007 and has a background in pharmacy and sales statistics. Sweden is considered progressive and exemplary in many areas for other European countries. I'm looking forward to learning about the self-care offerings in Sweden. Karolina, what measures have been taken in Sweden to support the population in self-care?
Well, as a representative for the Pharmaceutical Association, where we have member companies selling OTC pharmaceuticals, I would say that we've had quite a big change in the Swedish market if we look in a little bit longer perspective, since our pharmacies were reorganized in 2009. Before that, we had a state monopoly for pharmacies, and it was only pharmacies that could sell OTC products. Today, we have a few really big pharmacy chains, and they have both local shops in the cities and also web sales. So the OTC market is to a large extent based on e-commerce, and that was really a burst of that during the pandemic, where a lot of people got their pharmaceuticals from the websites, both prescription and OTC. Then we also have quite a large amount of OTCs that can be sold in ordinary shops, mainly grocery shops. There's not very much limitation. It's a large number of products, but it's very few products actually sold in grocery stores. So it's mostly painkillers, nicotine products, and those very common products. There we've had a few changes. So with paracetamol, there was a change when it comes to tablets, restriction for just pharmacies to sell them. And there's also a discussion now on the diclofenac products also, to what extent they could be sold outside of pharmacies. In the first case, it was more patient safety issues, and in the latter case, it's more the environmental aspects that is important in the ongoing discussion on how to handle those OTCs.
Do you have the numbers available? How much is sold online and pharmacy versus mass market?
I don't have the numbers. I could try and look it up as we speak, but there's quite a large proportion online sales. So that's an important area for the pharmacies, and not just the OTC, but other type of products like toothbrushes and skincare and that kind of products as well.
Very interesting. Thank you. Does LEAF have any suggestions for further strengthening the self-care in Sweden?
Yes, we actually have two possibilities, I would say, at the moment. The first one is that our present government has initiated work on a pharmacist-only assortment, so that part of the OTC or part of the prescription could go into a new category that could be sold without prescription at pharmacies, but with special advice from the pharmacists. So the report will come in the spring, and it will be interesting to see to what extent our medical product agencies see that products could be transferred. So, of course, the most interesting one is if prescription products would go into this category. But as I mentioned, on the environmental part, it might be also that some present OTCs will be taken into this new category to have more control over it, or what you should say.
A lot of countries have these in-between pharmacy-only categories. But what specific benefits would you say does the Swedish population gain if self-care would be stronger also in Sweden?
Well, we see, I think as in most countries, healthcare is under a lot of pressure. So, of course, self-care is an important part of healthcare, but our impression is, from the Swedish perspective, is that it's often foreseen or taken for granted. But in Sweden, it is quite about 10% of sales of pharmaceuticals. So it is an important part. And of course, persons who can manage their minor diseases by themselves, they don't, then healthcare don't have to be involved. But we find it difficult to have that discussion, because a lot of time the physicians get a little annoyed by when we say that OTC or could actually alleviate the pressure on healthcare. That's not very popular among the physicians. So I don't think we really figured out why, but we have an ongoing investigation or political committee that will look into to what extent we will have healthcare run by the state or the regions. Today, the regions, 21 regions, has the full responsibility for healthcare, but the government now would like to look into more if parts of the healthcare system would be a responsibility at the national state level. So we see a possibility to really promote different types of pharmaceuticals, where we think that the self-care is really an important part, where the government ought to have an ambition on how to use the possibility for self-care in the best way.
Yeah, and to save some money for the system, I guess.
Yeah, yes. In the end, I think that's, but so far it's been a little bit difficult to really get that discussion going.
The Swedish went a little different way during Corona. So I always had the impression that Swedish people are very self-reliant, and were also given the opportunity to be self-reliant. Would you say this could be an advantage for more self-care in Sweden as well? Would you say Swedish people have a good health literacy?
Well, I think in a general way, and I think that the Swedish healthcare system has also invested quite much in information services. So we have this national service where you can dial and talk to a nurse, but you can also find a lot of information on websites with sort of how you can diagnose yourself or know if you need to go to healthcare, and what you could expect if you have a cold or something like that, so you don't feel the need to go to healthcare. Also, information on OTC use or otherwise ways of handling your element. So I think we are well prepared in that way with that kind of information channels to the population. But then I think we are quite an obedient population. We trust very much in our agencies, and I think Swedish people do as they are told to a large extent. So I think that is part of why the Swedish way during Corona actually worked.
Okay. But the platform you were talking about, the Global Self Care Association, established in their Self Care Readiness Index, this was one major part that they say countries where such systems are established, where the population can go on reliable sources to look up for their health issues, they are very advanced in self-care. So that's, I guess, a good thing then in Sweden. For how long has this been implemented?
Oh, it has been ongoing. So it is the Swedish regions who owns this, and it contains a lot of different services, but I would say at least 10 years. And today it's also complemented with the possibilities to have to meet a physician digitally. And there has for a long time been a telephone service, so you can call for free and talk to a nurse, and they help you to decide if you need to go to healthcare or if you can take care of it yourself. And there is also prescription services and so on. So, well, I think we Swedes, we are always disappointed with what we have. So we are always looking for the next thing. So it's interesting to hear from someone outside that maybe we are actually well equipped in this area.
It seems so. Thanks for your interesting insights on the situation in Sweden. Would you have a suggestion for Austria now, looking back, and we have talked about how the Austrian health system works. What would you recommend us to be more advanced in self-care in Austria?
Well, maybe I'm not the right person to give that kind of recommendations, but some reflections. I think it is what was successful during the pandemic, I think, was that this reliance on people, that you actually decided yourself. We didn't have any hard restrictions, but still most people follow the recommendation to a very, very large extent. But what we have talked about here in Sweden when it comes to self-care, apart from this national platform for support, is also the importance that the different persons or professionals that you meet as an individual, that you get the same kind of information when it comes to self-care or OTC use, so that sort of the message from society is coordinated, so that if you go to a doctor, you get the same information as if you go to a pharmacy or if you talk to a nurse on telephone. So that has been some of the issues that has been discussed, and maybe that was easier when we had this monopoly. Not very modern to have a monopoly, but one of the advantages was that it was really easy to have a similar way of doing things all over the country. The other thing I think is that we have a long experience from buying your OTC online, and there has not been any clear disadvantages of that. So it has worked very well, not increasing the use or anything like that. And the same goes for the sale of OTC pharmaceuticals in grocery stores and similar outside pharmacy places. It hasn't really been any risk to patient safety recognized in that. We have had a few cases, but with very specific products that have been taken into pharmacy only. But on the general level, I think that has increased the availability to a very large extent, since Sweden is a very large country, but not such a big population. So if you live far away from a pharmacy, that's really helpful to have that online services.
That's definitely true. Well, Karolina, thank you so much for your insight. It was a pleasure having you here. Thank you so much for your time.
Thank you, Christina, for inviting me. Very nice to talk about these issues with you.
Self-care is an important topic for each individual and for the healthcare system as a whole. We at IGEPHA are committed to ensuring that the importance of self-care is further strengthened. If you want to learn more about the benefits of self-care, please send me an email at office@igepha.at. I'm also happy to inform you about the services IGEPHA provides for companies active in the self-care industry in Austria. For today, I say goodbye. See you soon in the next episode of our IGEPHA podcast.